me just share my presentation. Hi there. Again, thanking everyone for the opportunity to present this, and I can relate to some of the points that were made here by Dr. Jeevan from Germany and Dr. Shivarama Prasad from USA. I would say UK falls somewhere in between these two places, the state of practice of Ayurveda and the state of the practitioners of Ayurveda. So in the presentation today, what I would like to give is an overview of the current practice and education of Ayurveda in the UK and the current problems we have with the use of Ayurvedic medicines and procurement of Ayurvedic medicines, the legislations and guidance that underpin the practice of Ayurveda in UK, and then the challenges with regards to practice, use of formulations, registration, insurance, continuing professional development, research, clinical trials, and some of the opportunities of the present day and the future. Now, historically, the practice of Ayurveda has not been that great. There was no regulation until 1998. Even now, there is no full regulation, but until 1990.
Excuse me, Dr. Indu, can you make it full screen by clicking on the slideshow, please?
Okay. Sorry. Is that better?
Yes, yes. Now it's clear. Thank you. Thank you very much.
But in 1999, the first degree course outside of India was established with the Thames Valley University. It was a BA Honours Ayurvedic Studies for very mature students who has already completed their degrees or are from other professions. A 3-year course on Ayurvedic studies. And then in 1999, the same year, the British Association of Accredited Ayurvedic Practitioners were established. And by then, concerns on the efficacy of the safety of Ayurvedic medicines and education was becoming a great concern. So the government started a committee on the herbal medicinal products called HMPC, which was established in 2004. And the committee was established in accordance with the European Union directive. And the purpose was to lay down some procedures for the authorization, supervision, and pharmacovigilance of medicinal products for human use. So the current status of practice in the UK is that a qualified BAMS can practice if they are registered with a voluntary registration body. There are a couple of registration bodies, APA and BAAP, which I'll come to in the next slide. And then if the practitioner can practice if they have an insurance cover, and if they are willing to use the Ayurvedic formulations as per the MHRA guidance, which is the Medicines and Healthcare Products Regulatory Agency, which is the governmental agency which oversees the use of even conventional medicine products and use of blood products and all that. So MHRA guidance is following the footsteps of the Traditional Herbal Medicines Directive of 2004, which means that unlicensed herbal remedy cannot be sold after 2011, April. And then after 2011, one have to apply for marketing authorizations. And I have provided a link there, which is the application form. It involves a comprehensive form, which asks for quite a lot of detail on the contraindications and the contents and whether some endangered species are involved in the formulation and all those detail. So under this regulation, all herbal medicinal products are required to obtain an authorization to market within the EU. But the good thing about this directive, European Union Directive of 2004, is that individual practitioners of Ayurveda are allowed to make their own formulations and practice. So if they're not depending on a company-made, a pharmaceutical company-made product, they are allowed to practice if they have a registration and an insurance cover and formulate their own medicine. But you're not allowed to call yourself as a doctor, or or you're not supposed to offer a cure or a medicine. So it's like offering a support or a complementary medicine or an alternative rather than offering a healing or a cure. So registration in UK, like I said, there are two voluntary practitioner organizations, the BAP, of which I'm the one of the founding members, and the other one is the APA, Ayurvedic Practitioners Association. They offer different types of membership, for fully qualified BAMS, and there are associate level, therapist, student, and friends of Ayurveda level, which are all according to the different skill sets. They ask for the annual membership fee of £85, and they have a prerequisite for giving membership, which is a valid university certificate and proof of ID, passport, drive, whatever, and then full clinical practice contact details and evidence of CPD, which is the continued professional development. Now, practitioners' insurance details is a must to get membership, and they have certain costs associated with it. Obviously, as you can see, Vasti is included, but at a slightly higher cost, but it's not widely practiced. UK is not very friendly with regards to when it comes to health and safety. They have very stringent measures, and so Vasti is not chosen by many practitioners. They try to play it safe by just giving advice, lifestyle modification advice, and those kind of things. So for overseas practitioners intending to work, the main problem is that you need a valid UK work permit, which is very hard to get. So you need your employer to certify that you should be given an employment here, which is very hard for an Ayurvedic professional to get through. You can come as an engineer, any highly skilled migrant program, or as a student, but to get a valid UK work permit as an Ayurvedic doctor is almost impossible unless you have an already established clinic who's willing to sponsor you. And some doctors are coming that route. But there are challenges associated with that, which I'll come to that in a bit. And you have to provide evidence of practitioners' continuing professional development. Now, the guidelines for practice in the UK is set out by the Herbal Medicines Advisory Committee UK, set up in 2005. And again, like I said, you are allowed to have marketing authorization. You have to apply for that. Or you have to have unlicensed herbal medicinal products. You have to formulate it yourself as a practitioner. The role of the committee is to look at the safety and quality of the medicines and efficacy of the medicines. And you're supposed to provide detail in the labeling, the statutory warnings, even have the packaging written in Braille. So quite a lot of set of instructions are asked of the practitioner. So challenges. So some of the challenges are similar to what Dr. Jeevan and Dr. Shivarama Prasad was saying earlier. The lack of statutory regulation by Indian government or UK government is a big issue with regards to the practice of Ayurveda in the UK properly. There is very minimum standard for compliance only with the two voluntary organizations I mentioned earlier. They are, like I said, there is no clear demarcation between the expertise or the skill set of a BAMS qualified doctor as compared to a therapist. So just like Dr. Jeevan was saying, anyone who visits India for a holiday, goes to a beach and receives Ayurvedic treatment, they come and attend a few more weekend courses and they can call themselves a practitioner, a therapist. And there is no demarcation of roles between a properly qualified BAMS graduate from one of the Indian or Sri Lankan universities and where the skill sets of a therapist lie. So which means that there is an encroachment of areas, and that's not very helpful for the practitioner, for the properly qualified BAMS practitioner. So the lack of a statutory accrediting body is also a problem. For example, in conventional medicine, there is GMC, the General Medical Council, which looks after the interests of all qualified MBBS or MBCHB practitioners in the UK. But for BAMS practitioners, there is no such accrediting body, either with or without the help of AYUSH. There is no such body. So the interests of the BAMS are not protected. The MHRA and other guidelines restricting a full range of practice is a big challenge because, as you know, they have banned use of so many items, including ghee-based preparations, because apparently we do not pasteurize ghee the same way as European standards. So there is a lot of restrictions on the import of certain medicines. Then again, the costs are too much for marketing authorization. Like Dr. Jeevan said, we need to consider the costs when it comes to other European countries. The costs are around everything is invariably high. So we need to look at the costs associated with each and every activity around the practice of Ayurveda in different countries. Then the impracticality of the practitioner making complex formulations single-handedly. It's impossible to make kashayams or ghee-based preparations from your own home, from your own kitchen for a practitioner. So that's one big hindrance to using the whole range of Ayurvedic interventions possible. Then all of this is leading the market to go underground and creating confusion, and practitioners are just scraping through. And there is a lot of pilferage and exploitation and unsafe practices, and all of this is impacting on patient safety as well, with a lot of rasa-based drugs prescribed and not leading to toxicity, and then MHRA coming to know of it, and then bad reputation for the practitioner and the fraternity as a whole. Challenges again are that increasingly people are procuring products from overseas, which means that the Ayurvedic practitioners who are struggling to make a living are still, it's eating into their income, isn't it? And then people are buying over the internet. The practitioners have no guarantee of the safety of these products. And so it brings a certain reputational damage to Ayurveda and the practitioners in the press. There is a general hostility and cynicism from establishments, the GMC, which is the General Medical Council, the press and research, and multinational pharmaceutical companies, because obviously it's a multi-billion-dollar industry. So obviously, these are the stakeholders, the conventional medicine, GMC, press, research, they all have stakes in that. So obviously there is a little bit of hostility and cynicism, or at least unless proven otherwise, they tend to look at Ayurveda with a suspicious. So there is a great need to provide evidence more so than what another practitioner of another system of medicine has to provide. Now, some individual doctors may refer to Ayurvedic practitioners independently, but it's not available within the mainstream, which is a big challenge, I would say. But it's an opportunity as well in the coming years. Again, unqualified practitioners are a great risk to Ayurveda. Like Dr. Jeevan was saying earlier, there is no rhyme or reason as to who can practice and who cannot. Online courses are offered these days, and short face-to-face courses, weekend courses, or a short-term 1-month course. And then you can practice Ayurveda in the UK. That's the state of affairs. It's a threat to safety and a risk to the fraternity of Ayurveda as well. The other challenge is that there is no formal mechanism to record untoward incident reporting process, which is very important in practice in UK with regard to the conventional medicine. Practitioner associations, APA and BAB, are running their own yellow card scheme, using which you can report to the MHRA directly, or HAMC directly. It's based on the European Hon'ble model. And the other challenge is that there is no awareness of Ayurveda, or the difference between Ayurveda, which is a holistic approach to healthcare, as compared to use of individual European herbalism. So there isn't an awareness between what Ayurveda offers and how does that compare with other individual herbal treatments or herbal use. So they cannot consider the safety aspects. So people may go for cheaper products. So when not making use of practitioners, people are taking risks, which is all. It's like a perpetual cycle, you see. So anything could go wrong in that cycle, and then MHRA can notice that, and that can be held against the profession. All of this is leading to bad reputation to Ayurveda as well. And the HMAC reports meets regularly, and they have a publication as well, as I've mentioned there. So some of the challenges I've already mentioned: the work permit, visa, registration costs. Some practitioners are trying an alternative route, which is they get recruited as paramedic because of their knowledge of anatomy and physiology, and then they come here and start practice at a part-time level. Most are changing careers because of the existential struggle. And then there is lack of awareness generally, and increased costs. Then inadequate insurance cover needs a mention, and lack of reimbursement. Most alternative therapies are reimbursed, whereas some of the Ayurvedic therapies are not. It's only Indian head massage is reimbursed. So as you, I don't know how many of you know, but the majority of healthcare is provided in the UK by the NHS, the National Health Service, for which I work for. And it is free at the point of delivery for the taxpayer. So people are not used to spending a lot for health purposes or ill health purposes. So they would like a reduced cost of healthcare, really. And so if the people are not reimbursed for the services they take, be it Ayurveda or massage or whatever, they're not likely to come forward to make use of Ayurveda, you see. So that the inadequate insurance cover is a big issue in the practice of Ayurveda. Now, the factors influencing are, of course, the awareness levels, then the demographics, Asian population, female. There is a big interest from the Asian population and the female population for gynecological purposes and all that. But there isn't enough practitioners to cater for that need. Again, COVID-19 has been very difficult for the practitioners. Practitioners have not been allowed to open their clinics because of the social distancing and the lockdown, and they have been asked to close down all services completely, which has made an impact on their livelihood, really. And then the regulations and restrictions seem very counterproductive. So even though it was all in the interest of patient safety, it's driven the market underground. And the practitioners are struggling with the COVID as well. So the unstructured framework without statutory regulation has led to the underconfidence of practitioners and not engaging with the scientific community, and gaining acceptance in mainstream healthcare is also an issue. Now, I would like to draw the attention of the AYUSH representative to these things. We need some redressal for these issues. We need statutory regulation, or at least a semblance of statutory regulation to protect both the practitioner and the science. We need some regulation of medicines availability. So we need AYUSH to have some dialogue with MHRA, HMAC, to get some policies in place, some guidance in place. And then we need further intervention from AYUSH in terms of registration. We would like the some sort of support from the Ministry of External Affairs or the High Commission, so that we can have a registry of BAMS graduate therapists and have a demarcation of the skill sets and who can do what in terms of practice. And then some practical guidance as well as professional guidance, and then some continued professional development programs in a structured way, and some opportunities into clinical trials. And being in this country for more than 20 years, I know it's very difficult to get through to clinical trials. So we need the support of AYUSH, whereby we can have some formal discussions and get more access to clinical trials, so that we can evidence. And it's only based on evidence that you can make further breakthrough into mainstream healthcare. So the future opportunities are there, but we do need help from AYUSH and the wider fraternity. Brexit is a big opportunity. Britain will be looking at more trade opportunities. So this is the right time to have some involvement from AYUSH, the pharmacology, the pharmaceutical industry from India, and have some help towards creating this registry, and use the existing workforce as the people who can drive that change and who can bring Ayurveda more into mainstream medicine. There is something called personal health budgets in the NHS in UK, which means that patients are given a certain amount of a small budget to look after their own health. Like I said, that's not the case with healthcare in UK. It's free at the point of delivery. It comes from the taxes you pay. But this is an exception. So the patient can now decide with that budget how they can spend it. So Ayurveda can make use of that route and have a registry of services that we can offer, which is evidence-based. And if you put that on as an offer of services, there is a chance that people can make use of those services. Then again, there is something called social prescribing, which is again up and coming, that the UK government is very keen on implementing, which is they do recognize that health is not just lack of illness, or there is an acceptance that it's holistic approach. So you can have, access to the various services. So Ayurveda can get listed on that list of social prescribing. And that would mean that doctors, GPs, hospital consultants, anyone can prescribe their patient towards that social prescribing. But it needs to be listed. And for getting listed, you need to have some evidence-based and a little bit of a task force and a group of people with some coordinated work put behind it. Now, the other opportunity is that UK NHS is moving towards ICO, which is integrated care systems or integrated care organizations, which means that just like in India, it's in primary, secondary care, community-based services, different. The NHS is split into different areas. Now, the aim is that going forwards, they're all becoming one organization so that the patient journey is smooth and seamless between primary, secondary, and acute. And to look at the patient as a holistic entity rather than as a neurological case or that needing community intervention. So prevention, lifestyle, research, these are all going to come under the integrated care system. So again, a great opportunity for Ayurveda, because Ayurveda is not like conventional medicine. It's not about just treatment. It's holistic approach, including yoga. And long-term conditions are a big money drain to the NHS. It's long-term condition. You never get treated fully. You never get cured fully. It's a big money drain on the main healthcare stream, and Ayurveda can contribute a great lot to that. So this is the ideal time to get into the UK industry for AYUSH and the pharmaceutical industry and the businesses. Again, some of the opportunities I have already mentioned in the previous slide. So we would like to have a UK chapter of AYUSH really, who can work with the Ministry of External Affairs and have a government-to-government talk to progress what I've just listed earlier. Again, definition and protecting the profession and the different levels of competencies to differentiate between a therapist and a doctor, BAMS qualified doctor, guidelines with some entry exams like in the USA model, like Dr. Shivrama Prasad was saying. We do not have any exams to assess competencies. We need a structure and framework, something towards that. And then we need to provide clinical or treatment guidelines as well, so that we can get into the mainstream, like I was saying earlier, with the personal health budgets or social prescribing. Obviously, then we need to have an Ayurveda day. We need to celebrate that. We need to bring people together, the practitioners together, and improve the clinical trials and research facilities. So I've covered some of them earlier. The business and pharmaceutical industry needs to be bought in. So that's my talk. Thank you, and thank